Autism rates have gone up more than 200% in the last 20 years, and the numbers aren't slowing. But why? We talk about the rise in cases and the growing expense this morning on the Morning Medical Update. And good morning to all of you on this Friday. It is July 18th. I'm Jessica Lovell, and we are live here inside the Dulcie Simons Jr. Family Broadcast Studio. Thank you for being with us this morning on Facebook, YouTube, and on Twitter. Infectious disease physician Dr. Dan Hinthorn is in for Dr. Dana Hawkinson and will join us with the latest on the COVID count. Plus, we hear about autism spectrum disorder, but do we really understand it? This morning, we share new research and an initiative helping children with autism transition to adult care, and how some families are getting treatment at home. The Department of Occupational Therapy Education. She is at the University of Kansas Medical Center. And here next to me is Dr. Renee Jameson, a licensed psychologist in the Developmental and Behavioral Division here at the University of Kansas Health System. We'll get...
Yes. We are happy to see you, but if you can avoid it for this, we'd be happy to. If at all possible, especially these next several days with these crazy temperatures that we're going to have, if you don't have to be out in the heat, don't be out in the heat. Try to stay in, do your work, your gardening in the morning or the evening when it's cooler. Make sure if you are out in the heat, like we talked about, you're staying very well hydrated, taking some breaks to cool down. If you start to feel muscle cramps, headache, nausea, feel lightheaded or dizzy, those are all signs that you're getting overheated. It's time to get out of the heat and get cooled down.
Such great advice, Dr. Brian Beaver. Always good to see you. Thanks for joining us.
Absolutely. Have a great day.
You too. Jong and Dr. Renee Jameson. Ladies, thank you so much for joining us today. We appreciate it. Good to see you. You bet. All right, so Dr. Jameson, cases are up. Is it that we're getting better at diagnosing autism, or is something else happening? Kind of help us understand where those numbers are accounted for.
Sure. I think it's a few different variables. One is increased awareness about autism spectrum disorder and what it is amongst the public, and a better referral from doctors and providers. Another piece is over the last 20 years, the diagnostic criteria has shifted. And so moving from a more restrictive autistic disorder only to then the spectrum to then now just back to autism spectrum disorder. And so changes in that diagnostic criteria have definitely contributed to an increase in what we consider autism.
So Dr. Jong, it seems there's a lot we still don't know about autism, but what do we know that's making a difference as of now?
Yes, as Dr. Jameson mentioned, that the diagnostic criteria has changed, and autism is a spectrum, which means that it's quite diverse, and we have a saying that you see one person with autism, you see one person with autism. So it is really important to acknowledge that diversity among individuals with autism. Another thing that is really important, that's based on decades of research, is that early identification and diagnosis will lead to early intervention. And the earlier the intervention we can get for children with autism, the better outcome, a long-term outcome we can get as well.
So Dr. Jong, tell us a little bit about this program, a little bit about what it is, how people can access it, what the name of the program is, and then what resources you offer families.
Yes, at the Department of Developmental Division and the Center for Child Health and Development, we have a lot of services that are offered to families and of children across different ages. And a lot of those services are based on decades of research and evidence-based. So some of the programs that I want to point out here is that we offer applied behavior analysis service. Applied behavior analysis, or ABA, is one of the most evidence-based treatment option for autism, and it really focuses on support children and all adults as well to increase their skills in communication and functional independent living. And we have Bridge Clinic here that is designed for a short-term services in early intensive behavioral intervention, so that after children get their diagnosis, they would be able to receive services as soon as possible. And in the meantime, clinicians in the clinic will help them identify a long-term treatment option in their community. We also have another services that called Oasis Parent Training. This is a parent training developed by Dr. Linda Hasman-Powell in the Department of Pediatrics, and we have been providing services to parents even before the pandemic through telehealth services. And through Oasis Parent Training, we are able to support parents and make sure that they understand the knowledge, and they are also feel confident and comfortable practice some of the skills they need to support their children. So those are the two services that we provide. And Dr. Jameson also is aware of many other services.
Yeah, thanks, Alice. I was going to say that our clinical services within the developmental and behavioral division in pediatrics, about 80% of those services are diagnostic, so people coming in for an interdisciplinary evaluation for autism. And then we also offer behavior support clinics, so we're working with families with children with some challenging behaviors or individual therapy. A lot of our people with autism have coexisting mental health, anxiety, depression, and so especially in our teens, and so we're doing some cognitive behavioral therapy and things like that. But a lot of what we're doing is diagnostic.
So where does a parent begin? How do they know what program, down to just what, when they pick up a phone call or make a search to find out where they want to take their child to be diagnosed, what makes a difference and what kind of questions should they be asking?
I think it's a really great question to ask, and one of the things that we want families to know is to think about not just the diagnosis piece, but how, where to get connected for services if they're between 0 and 3, talking to infant and toddler programs, which is typically either based by your county or through co-ops in some of the more rural areas where there'll be multiple counties together. Once a child's 3, then early childhood special education is through the school district, and so contacting the school district to say, would I qualify for services regardless of a diagnosis. I think that's a myth that sometimes people think about, is that I have to have a diagnosis to begin some of these early intervention services, but that's not the case. We would recommend to families to do that either at the same time or even earlier and then to think about whether it's here at KU, Children's Mercy, and then there's some in Wichita as well, but primarily here in the metro area is the diagnostic services.
But as a parent, advice would be to just feel free to ask lots of questions.
Yes, absolutely. Again, focusing on the early intervention supports and then getting a referral from your doctor for an evaluation.
And let's talk about health disparities. We know that happens in all aspects of healthcare, as we know, but let's talk about how that's linked to income and access to healthcare, and then how do you help patients with autism kind of navigate through those issues?
Definitely disparities in diagnosis and access to healthcare. Telehealth is we've been doing telehealth for a really long time. Alice mentioned before the pandemic. We have a long history here at the medical center and within our division to do telehealth services. And so Kansas being a largely rural state, that's some of the initiatives that we have are around training people out in the community. We actually have a program called Autism Diagnostic Teams, where there's 34 teams across our state who are trained to collect information about red flags on autism and conduct some of the assessments, and then they summarize that information and send that back to us, and then we see the family and oftentimes the providers or the team that's done that assessment over telehealth. So that helps limit transportation costs for families in rural areas, increases access and earlier identification as well.
So there's some new research that we're going to talk about coming up here in just a bit, plus a new program helping pediatric patients with autism transition into adult care. We talk about the early on diagnosis, but this is a lifetime health issue that they need to be talked about, and we're going to talk about some different access to ways that they could get help for that. But first, we want to get to a question from one of our viewers, from Lisa. What is something people may not know about autism, or maybe what's one of the most understood things about autism? I want to get both of your opinion. Dr. Jameson, I'll just start with you.
Okay, well, I would say one of the things that might be misunderstood is that people with autism aren't interested in having social interactions. I think sometimes because autism is differences in social communication is one of the primary components, and so I think people have a misperception that individuals with autism don't want to have friends, and that's not the case at all. Some people are less interested, just like those individuals without autism, and so I think that is something that people have a misperception about. And I don't know, what do you think, Alice?
Yeah, I totally agree that as kind of mentioned earlier, that autism is a spectrum and is a very, very diverse group of population. And so some of them would have a lot of interest in making friends, and maybe the challenges is understand the social boundaries and understand some of the social norms. Some people may be needing a little bit more support with their social skills. Another thing that I think often that is kind of going back to the diverse nature of the population is that sometimes we either assume that autistic individuals may have some really high intelligence and very good skills in certain areas, or we assume that they are not competent in communication or social interactions. I think both of those assumptions could be wrong. And each individual is very, very different. So we need to really make sure that we do not have those assumptions before meeting a client or patient with autism.
And we're going to talk a little bit more about understanding and inclusion coming up here in just a moment. So before we get back to that topic, I do want to check in with infectious disease physician, Dr. Dan Hinthorn, who is in for Dr. Hawkinson today with the COVID numbers. Dr. Hinthorn made it funny. He said the hen is in for the hawk today. So I'm going to let you take it from here. And good morning. Glad to have you here on this Friday.
Thank you. Good morning to you.
Okay, Dr. Hinthorn needs the COVID count pulled up so he can see those numbers. All right, Doc, there they are, right up there on the wall. If you want to grab those COVID numbers and go through them right there.
Sure, yes. We have about the same number in the hospital as we did yesterday. We have 29 active, 8 ICU, 4 vents, and 10 recovering. So that puts us about 39. I think we had about 40 or 42 patients yesterday, as I recall. So, yeah, we're in the surge, just as we've been talking about for several days now. And it looks like that it's estimated that probably at least 5% of the United States population will get COVID each month now. So it looks like we're really increasing, really surging.
Yeah, so when we see even that little fluctuation of numbers, we're still in this what's considered increase. I want to talk about something. President Biden tested positive on Thursday for COVID-19. That would be a health concern for any 79-year-old. So what do we know about his condition? What can you tell us?
Well, apparently he's still doing okay, has mild symptoms. You know, he's been immunized with the Pfizer vaccine. He's had both boosters, so he's been really has had the best care possible. But yet the antibodies that are produced by either the disease or by immunization don't match exactly with this new BA.5 variant, and that's the problem we have. So people, and that's why we're having the surge, is because people who do have antibodies, who have spike antibodies, can still get the disease. That's our problem currently.
So your opinion on something. The CDC ends COVID-19 program. It's programmed for cruise ships. Do you think this is the right time since we're still in vacation mode? And let's face it, cruise ships are year round. What's that going to mean?
Well, I think they're trying to keep the cruise ships from going out of business. I think that's the real problem. Would I want to go on a cruise ship? On the basis of what we know now, I think there's a pretty likelihood that people will get a mild disease if they've been immunized. If they haven't been immunized, then they should stay off. But if they've been immunized and they're being careful and wear masking, they can probably get by with it for the most part.
Yeah, it's hard to find that balance, keeping a business open, but also keeping people safe and not spiking those numbers up. CDC signed off on Novavax, that COVID-19 vaccine for adults. So tell us the difference between the vaccines we've been hearing about for the last year and a half and Novavax. What would be the difference? Anything?
Yes, the mechanism that they're made by, the Novavax vaccine is an interesting vaccine because it's made by the old standard. It's a protein vaccine, and it's not just aimed at messenger RNA as the other one was. So the mechanism that the antibodies are made are different, and they're a little bit, the specificity is a little different. So I think it's a good thing, and some people who are a little afraid of the new technique with the messenger RNA will say, I'm really glad to have the old kind of vaccines that we used to have. It also has an adjuvant in it that stimulates the antibodies a lot more even. So with that ASO4 type thing, the adjuvant they have really will stimulate immunization. So that's good.
Dr. Hinthorn, thank you so much for being with us today. Please come back and see us, okay?
Thank you.
Good. Well, stick around because we're going to have some more questions for you here in just a bit. And we do want to welcome back our Facebook viewers. I know we lost contact with you for just a moment, so thanks for coming back to us. So we want to get to a couple other headlines on our topic of autism. And we want to share this with you, that we're learning that speech and occupational therapy can greatly help autistic patients, but we know that that can add up. On average, autism costs an estimated $60,000 a year until adulthood, and most of that is going towards special services, but also lost wages due to the increased demands that are often put on the parents. According to the organization Autism Speaks, mothers of children or caregivers of children with autism tend to serve as a child's case manager and their health advocate, leaving them less likely to work outside the home. And it's something every parent deals with as their child grows up, aging out of their pediatric care. But for children with autism, it creates an entirely new set of challenges. Research shows that teens with autism receive healthcare transition services half as often as those with other special health care needs. More than half remain unemployed and unenrolled in higher education in the 2 years following high school. And nearly half of 25-year-olds with autism, they have never held a paying job. So let's bring back in psychologist Dr. Renee Jameson and Dr. Alice Zhang, a board-certified behavior analyst. Ladies, thank you so much for being with us today to talk about this very important topic. Kids with autism soon, as we know, turn into adults with autism. So what support is out there for parents as they plan for their kids to head into adulthood? How soon, Dr. Jameson, should they start planning? I would imagine parents, they rely so much, as they should, on the state programs that are available for those 18 years and for the schools, and then boom, like that, they're out. So what do we do?
Well, if the person has an individual education program, which is an IEP through the school district, then the schools should help families start planning it by age 14 for what we call transition, meaning thinking about job, skills, post-secondary education. That doesn't always happen quite as soon as we would like in terms of the rigor behind that, but definitely should be thinking about the person's interests, what supports they might need in their next setting.
Dr. Zhang, weigh in on that as well. We say 14 to start getting ready for 18. That seems like a long amount of time to get ready for some of those post-18 programs. But is there anything else we should be thinking of or planning for maybe in those early growing up years?
Yeah, absolutely. This is a really, really important question that a lot of parents think about, and in terms of how we can better support children transition into adulthood, into independent living or different living situations as early as possible. So the general rule of thumb or the research has suggested, even though, as Dr. Jameson mentioned, a lot of times the IEP requires start transitioning planning by the age of 14, but the research has suggested if you can start as early as possible. So it's okay to talk and teach skills related to transitioning and independent living with a 9-year-old. So if you are talking with a 9-year-old about how to advocate for yourself, how to communicate, you are teaching those important transitional skills. So I think the message is really to try to start as early as possible.
I was just going to add to that, Alice. I think it's a good point. When we think about transitioning or preparing to live on your own, I think that it's something that you consider throughout that developmental course. And so, having families ask, okay, what are other kids or teens or young adults doing right now? How much support do they need? And to be thinking about that along the way. What are the skills, whether it's ordering at a restaurant, money management, volunteering someplace, just to really try to think about that trajectory, and then what supports an individual might need along the way, and then kind of get ahead of it in terms of, instead of just boom, you're 18 and to be thinking about formal transition. It really is about those day-to-day skills.
So in short, it's never too soon to incorporate that throughout daily life and skills. Dr. Zhang, what research initiatives are being done to help with this transition of care for children with autism into adults with autism?
Yeah, there's a lot of research that's being done at the University of Kansas Medical Center and also with the University of Kansas at the Lawrence campus. So there's a lot of research related to increase the skills of self-determination, self-advocacy skills, and also how to make supported decision and increase independent living skills. And one of the research studies that related to healthcare transition with healthcare is something that I'm currently doing. So I have a project that is ongoing, trying to understand better about the autistic children and young adults between the age of 14 to 25, what their healthcare experiences are like and what their healthcare transition looks like. As you mentioned earlier, that individuals with autism have a much lower a likelihood of receiving healthcare transition services. So this is something that is really, really important. And I want to also add, for individuals who live in the metropolitan area like Kansas City, they would have also more choices in terms of the healthcare and access to specialty services. So part of my study is also looking at comparing what healthcare experiences and transition look like between urban areas and the rural communities, as Kansas is a largely rural state. And we really hear different, so far the study is really very early in its stage with data collection, but we have heard a lot of really, really interesting and perspectives about people's real experiences. Like, for example, if there are families who are hesitant to tell their children what their diagnosis is, so a lot of the times they are not getting those transition and preparation until they become an adult and they are on their own. And that's a very, very hard transition to be thrown into a world that you need to figure out what I need to do with my healthcare, what I need to do with my insurance and social security application, all those type of things. Again, the research is still very early in this data collection stage, but I'm really, really excited about this opportunity to really have a better understanding of autistic individuals' experience with healthcare and healthcare transition.
I've got a couple more questions and then we're going to get to our community. Curious, and this is good news, but Dr. Jameson, we saw that there's a high cost of caring for kids with autism, but just this year it marked a major milestone. Medicaid now covers treatments for children with autism in all 50 states. Why and how has this been such a helpful change?
It's really helped with some of the disparities in access to care, because it still is very, I would say, on socioeconomic status. If you have more money to pay for services, kids are getting services earlier or more intensive, but Medicaid paying for autism services has expanded people who are able to receive those services. We still do have a disparity in the available providers that are providing applied behavioral analysis, ABA, like Alice was talking about. And so that's one of the frustrations that we feel when we make a diagnosis and we talk about therapy, and then there's huge wait list. And more providers here in the metro, but again, if you're living in rural Kansas, then it's even harder.
So what's a parent to do while they wait on that list?
While
the clock is ticking.
Yes, exactly.
That clock is ticking on their child.
Well, thinking about the services that they can access, whether it's through the early intervention, birth to 3 program, or early childhood special education, or through the school district, advocating for what they need. There's some telehealth programs where you can get some training, and so the parents can really act as the coach and the provider, advocating to the legislator. And so that's really how we've seen a shift in the paying for services, as we've been active in going and talking to state legislators about providing services for children with autism. One of the programs that I was going to mention that's been around, we are part of we are one of 62 programs across the state, across the nation, for leadership, education, and neurodevelopmental and related disabilities, or LIND. We have a Kansas LIND program. I think this is our 56th year being funded, and so we're part of a national network of university centers on disability. And through this program, we train interdisciplinary graduate students, medical students that come through for a short period, fellows, and we train them in developmental disability, interdisciplinary practice, and part of that is policy, advocacy, and being part of this larger network really helps increase resources for us. And so the Kansas Lynn program, has been around for a very long time and is a huge resource for our community, and it helps us be able to provide more services for families.
A lot happening, but it sounds like there's more that needs to happen to fill that gap. I want to ask a question from Julie. She said 1 in 44 kids has autism. That just seems so very high. What causes this? What do we know? What don't we know about what causes this? And I'll have you both jump in on that. Dr. John, go ahead.
Yeah, I was just going to say, kind of echoing what Dr. Jimson has said earlier about the increased awareness. Definitely, is a big part of it. Due to like decades of multiple decades of advocacy and education work that's done by the autistic community and also professionals who work in the field. I think more and more people are really understanding what autism may look like, and it is more likely for them to refer families and children for autism diagnosis or evaluation. I also think that, which is a great thing, not all the people who are referred are going to be diagnosed, but then this way we are able to identify early and able to provide early intervention as early as possible. Dr. Jimson.
I was just going to add, in terms of cause, we know that autism is associated with several hundred different genes, but there's not one thing that we're pinpointing there. There likely could be, something that you're more susceptible if you have a certain gene or variation in gene, and then there could be an environmental factor that kind of triggers that.
So Janice wants to know, where did the theory or rumor start that vaccines cause autism? Where did that come from?
Well, I guess it came from a study several years ago that actually had falsified data. And so also, if you think about the times you receive vaccinations, those early two-year markers, 1, 2, you're getting those. It's also the time that developmental milestones, the gap, if you're not meeting those, kind of gets bigger. So at first, you're just like sitting up and crawling and babbling, but then kids are putting, using single words around 12 months or so, and then putting 2 words together around 2, which again coincides with some of those vaccinations. But also, if you're getting behind, then you can start to see those differences more because.
So the diagnosis is coming at the time when you were getting vaccines. So they're coming at the same time, and that's where people are making that correlation.
Yeah, I think it's really, when you think about if a child is behind in something, you can tell because the other kids are gaining more skills, and so that gap between expected development and this difference is bigger. And so you start to see that around that same time that you're getting vaccines. So I think that part of it is, oh yes, then this is a cause. Families might think, oh, that was around the time I received this. But actually, another red flag for autism is regression or loss of skills about that age range too. And so regardless of vaccination, it's just kind of like correlation there.
I'm going to bounce over to Dr. Hinthorn really quick because we have a COVID question for you. Eric wants to know, should I or can I ask for the Novavax vaccine over the others? Is there a benefit now that that's been approved? If maybe I haven't, maybe if somebody hasn't had it before. If this is their first time being vaccinated.
It will become available, but it's not yet. It's just approved, and I think in the next few weeks it will be. I don't know how many days it's going to take, probably in a week or two, that a person will be able to ask for the Novavax vaccine instead of the messenger RNA vaccines from either Moderna or from Pfizer. Is there an advantage? We're not sure. There's no head-to-head comparison, so we can't be sure about that. If a person wanted to get that for one of their boosters instead of having the messenger RNA vaccine, it would be reasonable to try that. Those studies haven't been done yet, but it seems interesting that it might be of some benefit. There are hazards with every vaccine, so I don't know that it will be necessarily safer, but some people fear one versus the other, so it's great to have a choice.
Right. Just get vaccinated. Pick one and go with it, right?
Go with it.
Question from, who was asking this? Jeannie was asking this. Have there been any COVID deaths lately here that you know of? That I don't know if you're up on that information.
I don't have a tabulation of how many we've had recently.
Okay, we will get to that question when Hawk gets back. Question from Maggie, back on topic. Could you tell if a 2-year-old is autistic? And maybe that's a question we asked. Dr. John, jump in. Is there something a parent should be looking for in their child that would then prompt them to go get tested?
Yeah, there are some early signs of autism. With a 2-year-old, it's really great to making sure that you are always like watching for the developmental milestones and signs. And the CDC has a great developmental tracker that you would be able to just download on your phone, and you can compare whether at this age, whether your children is doing things that they are supposed to do. And that, I think that's a great tool. If you see a lot of the signs and developmental delay, it's always good to talk to your pediatrician. And in terms of autism, there are signs, for example, delay in communication, as Dr. Jameson has mentioned, and also maybe the avoiding of contacts. And there might be also some strong interest in certain things. For example, if they are really having strong interest in playing with cars, and they only play with cars, and if they do not have access to cars, then there would be tantrums and challenging behaviors that occur. And sometimes you can also see some kind of physical signs as well. So for example, if children are working on their tiptoes, or there are some gesture of physical mannerism that may suggest that they do things that other typical toddlers are not doing. Those could be some signs that parents can look for. But in the end, I think most importantly, I really would strongly suggest parents to use that CDC developmental tracker app.
Great advice. Dr. Jameson, question for you, because boys 4 times more likely to be diagnosed with autism than girls. And also, did I read that recently there's been a study done that women who are older, at maternal age, have a higher likeliness of having a child with autism? And I fit into that category because I was 41 when I had my son. And so would I have been a mom that would have said, I really need to be looking and paying attention to that?
There is an elevated risk for age, I think maternal and paternal age, and I don't know a ton about that.
Sure.
But I don't think you should be getting too concerned, because I think it's a very tiny risk.
Okay.
In terms of increasing the likelihood. Having one child with autism increases the likelihood of having another child with autism.
But if you have a boy, am I supposed to be looking at my boy differently than my girl at that age?
So I think one of the things to think about is no, and in terms of development, sometimes hear families that say, our physician said he'll catch up. He's a boy, he's going to catch up. And that's not the case. We would say, go check it out. See if someone's behind in language and you're concerned, then I would check that out. Alice mentioned, mannerisms, hand flapping. One of the biggest things early on too is what we call social reciprocity. And when you're young, that's showing something, looking at something and looking back to you, making eye contact, shared enjoyment with things, gestures, and that interest in toys and play and bringing you things. Mm-hmm. And the number of times kids look up at you and look back down at what they're doing is at a high frequency, and so looking at differences in those pieces. And you brought up boys being more likely to be diagnosed, and that is the case, and it's been kind of a consistent pattern for a really long time. There is an increased awareness around girls, and we used to think that they were more likely to have an intellectual disability, but now we're fear of missing some of those more higher functioning girls, and so we're picking up those. This is actually an area of my interest in terms of research and clinical expertise, and so to identify girls and to think about how it presents or looks different, and so we don't miss these girls. Obviously it varies, but in general, girls may use more gesture, eye gaze, and I may have more social interest early on, but then we see this increase in impairment and difficulties as girls become teens, and those social norms and expectations become much more difficult.
Right, so you have that number out there, more boys than girls, so you don't want to miss those signs. And
Absolutely,
that adds an added layer to the challenge of trying to figure out and diagnose.
It does, and it actually has this secondary impact too. So if you have more boys that are diagnosed, then what we know about autism and the criteria is based primarily on males. Same with the research. including individuals in research studies, much higher rate of males compared to females, and so we're not learning as much about these girls and what they look like across time. Also, that means programs, services, if whether it's in special education or autism-specific programs, have many more males in those. I have a program called GNO, or Girls Night Out, which is social skills and self-care for adolescent girls and young adults who have autism and other developmental disabilities. And we hear from our families all the time, well, so-and-so was the only girl in this specific program or in the social skills group. And so we really target skills that align with development and that are important, gender nuance skills, and that also address mental health, because with girls, teens and young adult girls and young women are at the highest risk for mental health disorders such as anxiety and depression. And so we see about 85% of our girls have at least one coexisting mental health condition.
Wow, I love the work you're doing and all I'm hearing right now. Jean wants to know, Dr. Zhang, jump in on this. He says he's hearing commercials that you may have a lawsuit if your child has autism due to acetaminophen, which we all give our kids. I mean, isn't that Tylenol, fever reducer? Is that true? Have you heard anything about that?
I have not
are
heard
those
anything
lawsuits a dime a dozen?
I haven't heard anything about that.
No.
Okay, well, then I'm going to go with a no on that one. If you haven't heard about it, I feel pretty good. We can move on. But interesting to bring that up. Let me see. There was one other good one I wanted to ask about. It is reported, Yenling is asking, it's reported that the level of dopamine in kids' brains is related to autism. I want to know whether regular exercise can increase levels of dopamine and lower the risk of autism. Do we know anything about that?
There's some studies out there about oxytocin and how that can enhance some of your social interest and affect. But in terms of reducing a risk, I would not see that as, a viable solution right now. Differences in someone's brain is what contributes to autism. And so, we tell families to think about the therapy. What has the most evidence behind it? What are you trying to impact? Take data and watch for that change. And so families often will, invest in something that doesn't have very much evidence and want to believe in that. But, thinking about, well, what does that make sense if that's going to impact?
The internet probably has not helped some of the work you do.
Exactly.
Some of the things you're trying to get out there. Okay, so I want to get to final thoughts. And my final thought is we need to come back and have more conversations about this because I have so many more questions I have, and I know that our viewers will as well. So please promise me you'll come back. Dr. Hinthorn, though, I want to get some final thoughts from you. We're heading into another weekend. Just kind of what's your message to folks about if they haven't vaccinated or haven't boosted to get out there and do it and just to be safe?
Final thoughts are, it was predicted a few decades ago that infectious disease was going to die out. We wouldn't have to have any problems with infectious disease. We've already talked about 3 different problems with infectious diseases this morning. We've talked about COVID, we've talked about salmonella in the turtles, and we've talked about vaccine and whether it causes autism. So 3 infectious disease areas that we all focus on. Regarding the vaccine and autism, there are a dozen studies that show they do not cause and are not related at all. These are well-controlled, double-blind, randomized controlled trials. They don't do it, despite the fact that Wakefield said that in 1995 in Lancet. That was retracted and deemed not to be true. In fact, the person who checked it out is true. Salmonella in the turtles. Wash your hands if you've got turtles. Don't let little kids handle them because it can be a disaster for little kids. So, yes, that's a problem. And the reason they get it, turtles get it, is because they feed turtles in the turtle ponds when they're growing with carcasses of expired turkeys or chickens, and that's what the animals live on. As far as COVID, preventing that one, vaccine, masking if you're around people that might be sick, if you're around close contact with people that you're suspicious of. So it's the same techniques that we've been talking about now for 2 years.
Yeah.
Keep on doing it.
All right. We found a turtle last weekend, but because Mom jumped in and said, don't touch it. I didn't know why I said don't touch it, but I didn't touch it. But it was a cute little turtle that I didn't let the kiddos touch it. So interesting. That's what I did not know about. All right. So Dr. Hinthorn, thanks so much for being with us, and come back and see us, please. And Dr. Zhang, just your final thoughts. What do you want us to know? What do you want to leave us with?
Yeah, one thing that I think is really important is that as the regional academic medical center, we have a lot of evidence-based services and research and programs for autistic community and for parents or autistic individuals out there. If you have questions, I felt like I would strongly suggest you to reach out to us, and we are more than happy to share information and resources as well. Another thing that I think is really, really important is that for us as researchers, clinicians, or healthcare providers in the healthcare system, we want to make sure that when we are designing or implementing those program services and even conducting research, we need to make sure that we are being inclusive of the voices of autistic community and parents and caregivers, so that those who are being impacted actually have a voice. And I want to share one message that is the kind of the spirit of a lot of the disability advocacy in the last multiple decades is nothing about us without us. So making sure we have their voice at the table.
Thank you so much. Dr. Jameson, I want to hear your final thought, but could you also, before you give that, just how do we all as a collective community do better? How do we become more inclusive? Teach us and tell us.
Okay, well, I think one of the pieces that Alice just shared about finding out from the autistic individual and families what they think is important. Mm-hmm. And so that helps people be more inclusive as well. Some of the work that we do with our program is we go out in the community. So our Girls On Out program is in places where you would do social and self-care activities. So at coffee shops or restaurants or fitness centers, salons, all those different places. And so we are providing the people that we work with information about autism and about the girls that we're working with, and so that they will feel more capable in the future too to work with people with various disabilities.
When I was growing up in a school, it always infuriated me now looking back that any kid that had a challenge or a disability or was different was kept so far away from the rest of us. They were a mystery. And now to know that my kids go to a school where kids are plucked out and brought in to be a buddy with a kid with autism, and they sit next to them, and they're entrenched in their world, and they get to kind of demystify this word that kids hear about. I just love that change, because I think it starts with the kids, don't you?
Absolutely. And something that's important, like in our program too, we have peer volunteers, so girls without autism, but we say, you're not a buddy, you're not a helper, you're a peer. Yes. And that you do all the same activities, set goals, and my program coordinator has a saying that we all have things to work on, and so that's really what we try to think about. How can we individualize? How can we leverage someone's strengths, and then support each other's areas that need to grow? And so we really use the peers and everyone in our group to create opportunities for success, so that people can build confidence and across settings and people, and then be more likely to engage in activities. And we asked about inclusivity, and so and to engage with your community is really important. When people think about social skills, I think that people go to friendship, but it's about so much more. And so these things are incredibly important for navigating your work situation, interviews, working in groups at school. And so they're really important life skills, and so we really need to create opportunities for people to experience success.
So we've a lot of strides. I love hearing all the work that's going into it, what you both and so many people in the community are doing. Still more to go. Yes. But any last final thoughts?
The last thing I want to say is, being an academic medical center, thinking about, not everyone can encounter someone with autism, and so to think about how we can include disability, and different groups of people within the research that we do. We have. And as a provider, not seeing that work as mine or Alice's, but that each person is going to care for someone in infectious disease or in the emergency room. And so to be prepared for that, and also to talk to the person. Alice mentioned including voices of autistic individuals, but also when you are working with someone in your clinic, to talk to that person and not to their caregiver. We hear that from adults with autism that say, the focus is still on talking to that parent or even their provider that gave them transportation there. So.
Thank you both for all the work you do, you continue to do, and thank you for teaching us and educating us today.
Thanks
I
for
promise
having
you'll
us.
come back so we can continue this conversation.
Absolutely. Thanks for having us.
Yeah, Dr. Jung, thank you so much. Well, we started a new segment here on the Morning Medical Update. It's called Foodie Friday. So today we're making some healthy burgers. Take a look at this. Have a great weekend, and we'll see you back here Monday at 8.
Today we'll be making turkey burgers with pickled onions. We're going to start off with a little bit of vinegar, little salt, and some brown sugar. We're going to take that over to the range, and we're going to saute up these onions to pickle them. So we're going to start off by sauteing our vinegar, our salt, and our brown sugar together for about 3 to 4 minutes until we get a nice little boil going. Then we're going to add in our onions, let that saute for a little bit. Once those get nice mixed in there, we're going to let them sit for about 30 minutes. You can also let them sit for about up to 3 days for a little bit more flavorful punch. Now that we have our onions going, we're going to start working on the actual turkey patties themselves. So we take about a pound of ground turkey. You can also substitute bison or ground chicken as well for another lean protein. We're going to take our ground turkey here, mix in with a little bit of breadcrumbs, some salt and pepper. We add a little bit of diced cilantro for a little extra flavor there. You can also use some other vegetables and seasonings as well. Anything you like to try, maybe some garlic powder, onion powder, something that won't increase the sodium. 1 egg right in there, and a little bit of milk. And we're going to make our patties. We will get that all nice and mixed in together really, really well. Once you have that all mixed in, you're going to form patties. You should be able to get about 4 patties out of here. Form that right onto your plate. And then we move on to the next step of the cooking process. So you want to heat your skillet up to about medium heat. Add a little bit of oil. You can also cook this out on the grill for that great summer barbecue flavor. Put your patty right on here, and we're cooking. And we'll want to cook that for about 4 or 5 minutes on each side until it's no longer pink in the center. And then we'll add our cheese. Today we're using a Havarti cheese for a little extra added flavor. We'll put that on for the last couple of minutes. Let it melt on there real nice. I happen to love a little bit of Havarti cheese, so we're going to go a little extra on this guy. Let that melt till perfection. All right, and now that we've got that cheese melted on there really nice, we're going to set that right on a whole wheat bun with a little bit of frisee lettuce. I like mine with a little bit of avocado. You also use a little bit of light mayo as well to top that off. We add our pickled onions. We have ourselves a delicious summer recipe that you can make inside or outside depending on how hot it is. And here we have our delicious turkey burger, great summer recipe with some pickled onions, Havarti cheese, frisee lettuce, and a little bit of avocado on the side on a whole wheat bun. Enjoy.
It's estimated as many as 43% of children have a sleep disorder. And with school just a few weeks away, how do we get them and ourselves back on track? I'm Jessica Lovell. Plus, new hope if you wrestle with good sleep. We'll see you Monday at 8 on these social media channels.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcasts. Now, everywhere podcasts are available.